Okay, good.
Hey, Oklahoma City, it's Dr. B from Optimal Health Associates. I'm here with Dr. Khan again from OKC Fertility. Today we're going to shoot questions my direction and talk about some of the things that she's seeing in younger women who are going through fertility and how that relates to pelvic floor stuff, urinary incontinence, Urogyn issues. So I'm going to let her kind of take over and we'll get rolling.
So, obviously, a lot of us who went through OBGYN training and then, in my case, fertility training, we obviously saw a lot of patients who had issues with urinary retention, urinary frequency, hesitancy, pelvic floor issues. And we all kind of were just like, well, these are problems that happen to maybe a little bit older people, people who have had babies, maybe prior surgery, issues like that. But in my own practice, I'm really seeing a lot of younger women who really don't meet that criteria. And so, part of why I wanted to talk about this today is just to bring a little bit of awareness to this, that this is not just a problem that happens to older people. This happens to people of every age, whether you've had babies, whether you haven't had babies, whether you have all these different medical conditions. And if you're experiencing some of this, you need to come see Dr. B. So some of the stuff that I've seen more recently is, so one thing was a teenager. So this is actually a very athletic young high school student who started to notice that when she would be running on the treadmill, she was noticing just a little bit of leakage of urine, just like a little bit of dribbling. And she thought that was a little bit out of the ordinary, kind of worked up for all the normal stuff, like it wasn't a urinary tract infection, she had never had anything else that was going on, and then it was just a question. So this is one of the things I wanted to ask you about.
Yeah, is she like a power lifter?
Not really. Yeah, a runner. She had done a little bit of weightlifting. That was just part of their program, but it wasn't a ton.
Okay.
But maybe it was too much for her because she was doing some weightlifting.
It's possible. So a lot of times in athletes, if you get an imbalance in the musculoskeletal makeup of your hip, so if you have really tight hip flexors or something of that nature, they can then throw off your pelvic floor. And when that happens, the muscles of the pelvic floor are kind of, if you imagine the pelvis is like this bowl, and then the bottom is like cut off of it, and then we line the bowl with a bunch of muscle to keep these balls in the bowl. So that's essentially what happens with the pelvic floor is you've got the bony structures and then the muscle, and then this is like your uterus and other things. And so when those muscles start to spasm, what can happen is it can do all the things you just mentioned. It can make it difficult to empty, can make you leak when you cough, laugh, sneeze, jump, lift, exercise. It could make you have urgency and frequency and leaking associated with that. For some people, it causes pain with intercourse or just random pelvic pain. And then others can even have problems stooling, so they'll leak stool or can't go with that constipation. So my guess in a young person like that that's athletic is probably musculoskeletal. The good news about that is if it happens fast, it'll go away fast as long as you address it. But if it happens over a long period of time, it takes forever to get those things to resolve, but they can. And then the other things you maybe want to consider looking at would be neuromuscular issues, like multiple sclerosis and things like that. Although with the cosmesis leak or the exercise leak, it's probably unlikely, but in young people that have urinary issues, it's a little bit out of the ordinary, it may be prudent to look for those things.
That is super helpful, and it's super helpful to really remember that it is just the muscles. And I think what you said is so poignant in that if it comes on fast, it goes away fast, and if it comes on slow, it goes away slow, because you're like reconditioning and training your muscles a lot of times like work in a different way.
Right. And a lot of women just say, okay, I'm leaking when I lift, so I'm gonna like squeeze all this stuff and then try to do squats or run, and then they just throw their whole balance off and it just perpetuates. So then, okay, now the muscle that was spasming is relaxed, but then the ones that were pulling the weight while that one was spasming are now spasming. And it's just this perpetual game until they probably for somebody at her age, the key is just getting into a physical therapist.
Right.
Where they can, first they'll teach her how to relax the pelvic floor muscles and then help her rebuild the brain-body connection to contract them again so that she doesn't have that issue.
I think this is a really important point that a lot of people don't know about, so I actually want, if you don't mind, to talk just a little bit about pelvic floor physical therapy. So what it is, like what all the different things it encompasses, like, what different problems it can help people with, because I think people have no idea about it, and it's like a life changer for some of these issues.
Yeah, so I'm a firm believer in pelvic floor physical therapy. The long and the short of it, there's, at least in Oklahoma City, they're all female. I'm sure there's guys out there that do it, whatever. But what they do is they work on the pelvic floor muscles to help you recondition those muscles. So the same way if you have a spasm in your back or your shoulder, you have a physical therapist, they kind of, they'll do certain maneuvers to release the muscle. They can even do what's called dry needling, where they put little acupuncture needles in the muscle for your back and things like that. Everything they can do there, they can also do in the pelvic floor. So they treat all kinds of conditions, and it's a really great non-surgical option. So for a lot of people, it can improve things. It may not get rid of things altogether. Like with the incontinence issue, the goal, for instance, that young lady would be, one, make sure spasm is going, and then two, to recondition the urethral sphincter, the whole back muscle for the bladder, so that she can call on it when she needs to. So they'll work you through prep scenarios. Like, okay, you're about to start running. What are you going to do? And then you'll do it and then say, okay, that's right, or no, it's not. Try again. And until you make the connection, you really don't know you're making the connection.
You need somebody to be like walking you through that and telling you this is what you want to do to be able to do all these other things and do it the right way.
And there are a few physical therapists out there. There's one in California. She has a website and like sells DVDs. I don't even know if people have DVD players anymore, but it's called Your Pace Yoga, and she's like a total yogi, but then a physical therapist too, to focus on pelvic floor. So she has instructional videos on like urinary incontinence, pelvic pain, fecal incontinence, endometriosis, scar release, so like all kinds of stuff. So if you're nervous about going to see somebody for it, get the video. But the data supports that having somebody there, like literally touching the muscle and going, squeeze this one, then you know you're doing it right because they're telling you you're doing it right. You don't have to kind of guess if you're doing it right. So the data supports that you'll actually fare better if you start with a pelvic floor physical therapist, and then maybe when you're done with them, working forward with some sort of program at home.
I think that is super helpful, and one thing that I do want to point out too is I feel like everybody really associates a lot of this stuff with like bladder issues, urinary incontinence, potentially fecal incontinence, but it can really go into the realm even of pain with intercourse. And so I think a lot of times people's first guess with pain with intercourse is something like potentially there is an infection, other issues like that. It really can be that same muscle imbalance, and this is something that I think that pelvic floor physical therapy can help with also.
Yeah, definitely. So for instance, like a lot of times I'll have people come in and say, I've got this burning pain during intercourse and even after intercourse, and usually their history pans out as it's bothersome during, but then the next 2 days are terrible. I feel like I got kicked or something. And that is just bringing pelvic floor muscle issues.
Not infection, which is what everybody thinks it is.
And it can even make your bladder feel like you have a UTI or you have a vaginal infection. And so the reason that happens is you have all these nerves that run through the muscle bellies, and when the muscle spasms, it chokes the nerve off, so then you start getting this pain signal that goes to your brain. So for some people, you gotta remember the pain fibers are the same ones that cause itching and pain. So some people get that itching, irritated feeling, and other people have sharp, stabbing, burning pain or cramping pain. It all depends on kind of how their brain interprets that. But yeah, physical therapists can work through relaxing that muscle belly and relieve a lot of that. And in the meantime, there are things that we can do medically to bridge that. So there are certain medications that will help with nerve pain, will help with muscle spasms and things like that. I try to keep people off of them. But a lot of times when people are working through that, they need something for acute relief. So we'll start them on something, and then as they improve, let them dial it back, and then you're back to normal. But then the key is, once you feel great, you gotta keep doing your exercises. Because if you don't, you'll regress, and you'll be potentially regress. Not everybody does, but potentially regress and be right back in that same scenario. So it's something about the way that your biomechanics works that sets you up for that.
Super helpful information. I do want to go back to one thing that you were talking about, and it's really about urinary retention. Because this is another thing that I feel like I, as a fertility provider, am seeing a little bit more than I thought I would, I guess, when I first started out. And so that's just the inability, either partially or completely, to empty your bladder, or feeling like maybe you have a really weak stream, or you're not, you're just not emptying completely. And so I think that, one thing that I always thought was so interesting was just that dynamic between the actual bladder muscle and then all the bladder neck muscles that are kind of doing different things.
Yeah.
One's trying to empty, one's trying to prevent you from emptying, and it really just goes back to that muscle kind of juxtaposition. So if you kind of talk about that, I can learn some.
Yeah, so when you void, the bladder contracts and the urethral sphincter, the whole back muscle is supposed to relax so that things can come out. There are conditions, like there's one called detrusor, which is the bladder, sphincter, which is the muscle, dysynergia, which means they just don't talk well, they don't communicate, so they're not on the same wavelength. And so you'll get the bladder contracting and the sphincters contracting too, and it doesn't pick up on the signal and you can't pee, and you get these really nasty bladder contractions. Most of the time, I've seen that in younger people. They either have some neuromuscular disease or they've had some sort of trauma, like a back injury or spinal impingement from a car accident or traumatic brain injury I've seen, like after a car accident, it's a brain bleed that resolves, but then now they've got this weird bladder stuff happening. That's usually where that stems from. And there are definitely things we can do for that too, even in people that have had traumatic brain injuries and things like that. There's one device in particular that I really think works well because it works on that overactive bladder component, that gotta go, but then it also works on the inability to empty. So depending on where you sit in that spectrum, you're pretty much covered, and it's called an interstim, which is like long and short of it is a bladder pacemaker device that's implanted in the hip, and it stimulates your bladder 24/7 to help you empty and to help with urgency, and you actually control it via Samsung Galaxy phone, which I think is crazy the way they can do that, but that's how that works.
It's just so interesting. Okay, so the last question that I had was actually about prolapse. So this is again something that I always really in my mind had associated with being like a little bit older, maybe having a lot of kids vaginally, but I've seen it in younger women and even in some circumstances women that hadn't had kids. So can you just kind of talk a little bit about that?
Yeah, so the biggest risk factor for prolapse obviously is children. You push a bowling ball out and things happen. In women who haven't had children, you have to start looking for other reasons. And the big one that I see in super young women in their 20s that haven't had kids and have prolapse is usually a connective tissue disease. Like there's something called Ehlers-Danlos, where essentially all your ligaments and everything are real stretchy and it just doesn't hold very well. So then the weight of the uterus, even if it's a normal weight, will start pulling on those ligaments and things will slowly drop over time. Anything that causes you to bear down in your abdomen can increase your risk. So chronic constipation, people, kids have problems defecating, and then they just develop this poor stooling habit over time that works for them, and then they're 20-something, and now they're still bad constipated, working through that, either it's IBS or whatever the reason is, and then now I got this weird bulge, and I feel like I'm trapping stool there, so it pushed so hard that it stretched out the structural layer. So those would be probably the most common things in younger women.
Have you ever noticed any nutritional correlation between any of these things, like especially for things like prolapse? I'm just curious now, like if there are ever situations where somebody who doesn't get enough protein, for example, doesn't have collagen, doesn't have the things that help them keep these things strong and supple.
I don't know if there's data to support that, but it makes logical sense that if you're deficient. So it said, for instance, anorexic and bulimic women, that in and of itself, if it's bad enough, will make them hypoestrogenic or low estrogen. So they're essentially postmenopausal. So they start losing bone mass and your connective tissue and everything else can start acting more like a postmenopausal woman. So I guess in theory, if you're not getting enough calories, that could happen. And then definitely with muscle recovery, if you're not getting enough protein and you lift heavily, you can be putting yourself at risk. So the key is knowing how to lift properly so that you're engaging the right muscles so that you
Safety.
don't end up having.
Yes.
And guys can get this stuff too. It just looks a little bit different.
Right. Very interesting. Well, thank you. I've learned a lot.
Yeah. Anything else? Yeah. So we talked about incontinence. We talked a little bit about prolapse. We talked about neuromuscular conditions that can lead to prolapse or to incontinence and retention. We've touched on connective tissue disorders. So if you can take your finger and bend it back all the way, you may be at risk for earlier prolapse if you're going to have it. Now that being said, not everyone gets prolapse. Most people don't, but it is something that happens, especially after kids. We expect there to be some laxity. The vagina is not supposed to be a rigid stovepipe. It's supposed to be dynamic and be able to move. And so, stovepipe. Or your urethra for that matter. That's actually a medical term, stovepipe urethra, or a fixed urethra where they had scarring from delivery or other things to consider that trigger my brain with the younger lady is if she's had any bad Skene's glands infection, which is essentially a gland that lives right next to the opening of the urethra where you urinate. So you can get little infections in there and they can fester and sometimes they'll pop and drain, but other times they will grow towards the urethra. So and then it'll attach to a little tube and it's called a diverticulum. It's like a little water balloon that just sits there and collects urine, and then it can get infected and so you start leaking from that, or just pushing on it forces that little bit of urine to come out, and then you do your business again and you're exercising and it slowly fills back up, and then 20-30 minutes later you do a really heavy squat or something and then out it comes again.
Is that something that's going to be more common in younger people or older people?
Usually it's a trauma deal.
Okay. So it really could be anybody.
Or somebody that's just, for some reason, they just can get these continuous infections. I would say that's probably more of a rarity, but I've seen it.
What about stones? Kidney stones, bladder stones, is that predisposed to this? Because I feel like we see a lot of this.
Kidney stones and bladder stones would be more towards that overactive bladder, not so much the cough and easily, because the stones will sit in the bladder and irritate the lining, and then you just feel this need to go all the time. Obviously, God forbid, but bladder cancers can also cause that, but in young people that don't smoke, that don't work with heavy chemicals, that's not what it is. And you don't see blood in your urine, or you never had blood on your urine tip, and don't worry about it. I'm just putting it out there in the universe as an option.
Be very thorough.
Yeah. Anything else for today?
I think that's everything. I feel like we've covered a lot.
Okay, and if you guys need references to good physical therapists, there are really great physical therapists in Oklahoma City. Feel free to reach out. I'll give you their information, or you can probably just dig through my Instagram because they're all on there. And we kind of fire back information back and forth. So when we have patients that are mutual, they'll sometimes give me feedback that I wouldn't pick up on in the clinic because they work with them every week. Say, hey, the person's making great progress, but then we've plateaued. I think maybe you should consider doing X, Y, Z. Okay, that's helpful. Yeah, let's go for it.
So it can really be like a very multidisciplinary kind of patient-centered approach.
Yeah.
We all shoot for all the time.
Yeah. And so, and if you need, I just encourage, if you're going to consider going to physical therapy, at least know what you're treating, because a lot of these things can look very similar, and if you just roll in without a diagnosis, they'll do their best to figure it out, and a lot of times they can, but sometimes it's a little bit more complex than what it sounds like. And so having that diagnosis really helps them tailor your therapy to
just better outcomes.
in general. Yeah.
You want to talk about the period problem?
Oh yeah. So before we go, we're doing this project called period poverty, or eliminating period poverty. We don't really have a title, but the whole point is we're trying to get rid of period poverty, which essentially is there are these deserts of feminine hygiene in usually lower income communities where they can't access tampons, pads, feminine hygiene products for young ladies. And so these young ladies end up not dropping out of school, but skipping multiple days throughout the year. It really impacts their ability to stay competitive with their classmates because they're missing so just because they're sitting home because they're bleeding through their clothes. And so we are doing a product drive. So you go on our Amazon wish list, and we'll tag it to this. And you can just go on there, and it's all the stuff that we're working with Dell City High School, all the stuff that they've requested that they need for their young ladies. And so you can order it online, they'll ship it directly to our office, and then we'll take it there and drop it off for them. We've had a really great response so far. While we're here, I'll probably unload a couple of the boxes. They're almost to the ceiling at this point, so it's pretty cool. But yeah, we would love for you to participate. We're aiming for 2/28 is the last day, but if you're on there and it's not going to make it here before then, you can still donate it, and we will get it there. So, keep the donations coming. We really appreciate it.
Yes, thank you so much.
Yeah, thank you. All right, Oklahoma City, thanks a lot. You know how to get in touch with us. Call problems.